This is your trusted news, bringing you the latest and most comprehensive updates on viral outbreaks and health advisories from around the globe. Our goal is to provide you with clear, accurate, and actionable information to help you stay informed and safe. In recent weeks, there has been encouraging news regarding the influenza situation. Reports indicate a steady decline in influenza cases for the past 6 weeks. According to the Korea Disease Control and Prevention Agency, KDCA, the number of suspected flu cases reported by 300 sentinel medical institutions nationwide during the 7th week of this year, from February 9 to 15, was 11.6 per 1,000 outpatients. This is a significant drop from the peak of 99.8 cases per 1,000 outpatients observed in the first week of January. While this decline is promising, the current figure still exceeds the epidemic threshold of 8.6 cases per 1,000 outpatients, indicating that vigilance is still necessary. In addition to influenza, infections caused by Group A rotavirus, which predominantly affect infants and young children, have also shown a decrease. The KDCA reported 160 cases during the same 7th week, a 21% reduction from the 203 cases reported the previous week. However, despite this decrease, the number of cases remains significantly higher than the 58 cases reported during the same period last year and exceeds the average of the past 5 years. Rotavirus infection leads to acute gastroenteritis, with symptoms such as vomiting, high fever, and severe diarrhea lasting between 4 to 6 days. Parents and caregivers are advised to maintain strict hygiene practices and ensure that children receive appropriate vaccinations to prevent infection. Turning attention to norovirus, another common cause of viral gastroenteritis, the number of reported cases has remained relatively stable. During the 7th week of this year, 432 cases were reported, comparable to the 437 cases reported the previous week. Norovirus is highly contagious and can cause symptoms such as vomiting, diarrhea, and stomach cramps. It is crucial to practice good hand hygiene, especially after using the restroom and before handling food, to prevent the spread of this virus. There has also been a notable increase in cases of viral hemorrhagic fevers, VHFs, globally. VHFs, including diseases such as Ebola and Marburg virus disease, are characterized by severe multi-system involvement and can lead to significant morbidity and mortality. The KDCA has issued advisories urging heightened vigilance and preparedness to prevent potential domestic transmission. Travelers returning from regions experiencing VHF outbreaks are advised to monitor their health closely and seek immediate medical attention if symptoms develop. Concerns have also been raised regarding B virus infections, also known as monkey B virus infections. This rare zoonotic infection can be transmitted to humans through contact with macaque monkeys or their bodily fluids. While human infections are exceedingly rare, they can result in severe neurological symptoms and have a high fatality rate if not treated promptly. Experts emphasize the importance of immediate wound cleansing and preventive antiviral therapy following potential exposures to mitigate the risk of severe outcomes. In light of these developments, public health authorities recommend several preventive measures to reduce the risk of viral infections. Ensuring that you and your family members are up to date with recommended vaccinations, including those for influenza and rotavirus, is critical. Regular and thorough handwashing with soap and water is one of the most effective ways to prevent the spread of many viruses, including norovirus and rotavirus. Properly cooking and handling food can prevent foodborne illnesses. Being cautious with raw or undercooked foods, especially seafood, is important, as they can be sources of norovirus. If traveling to areas with known outbreaks of VHFs or other infectious diseases, adhering to travel advisories, avoiding contact with animals that may carry viruses, and practicing enhanced hygiene measures are vital. Finally, if you experience symptoms consistent with any of the mentioned infections, seeking medical care promptly is crucial, as early diagnosis and treatment lead to better outcomes. Staying informed and adhering to public health guidelines are paramount in protecting yourself and your community from viral infections. We will continue to monitor these situations closely and provide you with timely updates. Remember, your health is a shared responsibility, and through collective vigilance, we can mitigate the impact of these viral threats. Thank you for tuning in. Stay safe and healthy.